Sydney. I'm going to be doing your head-to-toe assessment today. Shouldn't take longer than 15 minutes. Do I have your permission to do so?
Yeah.
All right. And so can I get you to verbalize your name and date of birth?
Madison Martinez, 10302.
All right. And I'm going to check that against your wristband really quick. Perfect. And do you know where you are, what day of the week it is, and why you're here?
Yeah, it is Friday. I'm at the Loyola Sim Lab doing my head-to-toe assessment.
All right. So patient is alert and oriented ×4. Do you have any allergies?
Just cat allergies.
Okay. What's the reaction?
Just hives and a swollen throat.
Okay. And are you in any pain today?
No.
If she was, I would have her rate her pain on a 0 to 10 scale, 0 being the least amount of pain and 10 being the most. So when she was walking in, I assessed her gait. There's no limping, so gait appears steady. And then just assessing her physical appearance right now, she doesn't seem to be showing any signs of distress. Her mood is good, her speech is clear, she looks her age, she appears to be hygienic, her posture is good, so all of that is good. And then her head is normocephalic, it is symmetrical, positioned correctly on her body. And then starting with her scalp, there's no obvious lesions, and the distribution, quality, and texture of the hair is all good. Eyes and eyebrows are symmetrical on the face, they are positioned correctly, the color of that is good. And so if I could just have you look straight at me. All right, and just follow the pen. All right, so pupils are equal, round, and reactive to light and accommodation. The nose is midline on the face, symmetrical as well. If I could get you to lift your head up. Perfect. All right, and cover one nostril and breathe in. All right, now the other one. Perfect. All right, so there's no drainage and patency is good. And then if I could get you to open your mouth and stick out your tongue. Say ah. Perfect. All right, so lips are moist and pink. There's no lesions or cracking in the gums, teeth, throat, tongue, all of that is good. Tonsils are +1, and the uvula moves up and down, so that's good. And then the ears, do you have any hearing loss?
No.
Do you use any hearing aids?
No.
Okay, are you exposed to any environmental noises?
No.
All right, and what's your method of cleaning?
Just Q-tip outside of the ear.
Q-tip outside of the ear? Okay, that's perfect. And then can I get you to roll up your sleeves, please? All right, so assessing the arms, there's no obvious lesions on the upper extremities. The patient does have a tattoo on her right inner arm, but there's no redness or swelling. The skin is warm, dry, and intact. Assessing turgor, there's no tenting, so that's good. And then assessing the nails, they're symmetrical, there's no signs of clubbing. And then if I assess cap refill, takes less than 2 seconds, so that's good. And then assessing the respiratory system, I'm going to be listening to the breath sounds. I'm going to start in the bronchial area. All right, bronchiovestibular. And vestibular. All right, and then if I could get you to move your arms so I can listen to the lateral lung fields. All right, if you could sit up and swing your legs over that way so I can listen to the back. All right, and again, starting with the bronchial. All right, bronchiovestibular. All right, and vestibular. All right, you can lay back down on the bed. Oh, and while I have this out, I'm going to listen to her heart sounds using hip to mat. So starting right here. All right, over here. All right, so lung sounds were not adventitious, so that was normal. Heart sounds are regular. If I was in a healthcare setting, I would listen to the apical heart rate for 1 full minute in order to determine the heart rate, but it is regular, so that is all normal. And then for the GI system, when was the last time you urinated?
About 3 hours ago.
Okay, and your last bowel movement?
About 3 hours.
All right, was there any pain?
No.
Okay, and if I was in a healthcare setting, I would look at her abdomen, inspect for color, symmetry, contour, and pulsations. So right now I'm going to listen to her bowel sounds starting in the right lower quadrant. All right, right upper. Okay, left upper. left lower. Vowel sounds are normal, and then palpating in that same fashion. Okay. There's no rigidity, large masses, pulsations, or tenderness, so that's all good. And then could I get you to roll your pant legs up a little bit? Alright, so skin is warm, dry, and intact. There's no obvious lesions. And then if I could have you swing your legs over here. Alright, and could you point your toes down? Alright, and up. Perfect, so range of motion of the ankles is good. And then if I could just get you to push against my hands while I push back. Okay, perfect. And I'm going to do the same with your hands. Push down, alright, push up. Perfect, and push out. Alright, so patient exhibits +5 muscle strength, and then you can lay back up on the bed. Alright, assessing her dorsalis pedis pulse. Okay. Alright, pulse is +2 bilaterally, and then doing the radial pulses as well. Alright, radial pulses are good. And then can I get you to put your hands up like this? Put them down, and then in a circle. Alright, so range of motion of that is good as well. And then that is everything for my head to toe assessment. I would make sure the bed is locked in the lowest position. Side rails are up with the collar in reach. And do you need anything else from me? Alright, and that is everything. Thank you.